I'll share with you all. I just received my 5 year, what is it? My 5 year term like certificate. So I've been here for 5 years. And it has just been so rewarding. The Board of Health hired me to restructure the health department. One of the things they said, are we really doing the things that we're supposed to be doing for the community? So I'm very fortunate to have not only just a great team, but also a great board who's really engaged in what we do and want to make sure that they are fulfilling their role as Board of Health members. And so we've had growing pains. We've had to restructure. We've had some layoffs, and that was very difficult. But the intent was to shift from a direct service model to more of a population health base. And so today I will talk about that, all the things that we do. We don't just deal with COVID, but we deal with other things as well. So I'm going to share my screen and just please, I'm learning a lot about technology these days, so please bear with me. What you will see, you should see the screen that says becoming the community's health equity strategist. And so that has been really our journey. And so that's the title of this presentation. Um, so before I also begin, I want to talk about our vision, mission, and a little bit about our organizational structure. So, our vision is that we exist to ensure that people in our community have equitable opportunities and resources to lead healthier, more fulfilling, and longer lives. Our mission is that we protect people in our community from health hazards, promote healthy behaviors, and prevent disease. I hope that you all feel that is what we have been doing for the past 18 months. We are not only ensuring that people are being protected from COVID-19, but behind the scenes, we also answer and ask questions, and answers and provide solutions as are we reaching everybody, so is our message being culturally responsive? Are we reducing barriers, for example, our vaccination efforts, at times there are transportation barriers, are we ensuring that we are also going out to the communities to ensuring that people are getting the vaccine? And so we do a lot of things behind the scenes, not in just the protection part, but also in ensuring that the people are receiving equitable opportunities and resources to lead healthier and more fulfilling lives. And so that is really our vision and mission. When I started, we had a divisional structure. So we had two different divisions. One was environmental health and enforcement, and the other was known as schools, outreach, and clinics. And I just felt that divisional structure created more silos internally. So we restructured to have actually more uniformity. And so the reporting structure of the health department no longer has the division. I have a deputy director who reports directly to me, and then the program operations are under that particular role. The strategic planning, the vision and mission are all under me, and the financial aspect of the agency also are overseen by me. So I mentioned earlier that we restructured since my hire to focus on the essential services of public health. I was very intentional in reducing the duplication of services. So the question that was always asked to the team, are we best to provide this service? Sometimes like public health gets funding, and I think that one of the things that's so important for us is that even though the funding comes through us, maybe there's community organizations that this is more in alignment with their vision and mission. And so we can subcontract those fundings to the organization that is really directly doing the services that maybe at the state level they're asking the health department to do. An example of that, when I came on board, we had our home health services. And so I said, team, why are we doing this? We have so many home health entities. We have the Visiting Nurses Association. Public health doesn't need to be doing this. We can subcontract those funding to those organizations that this is really what they're focused on. And so we have a very good relationship with VNA, and so they provide home health services and we subcontract those funds. Another thing was the school nursing services that we were predominantly known for. And my ask is again, are we best to provide those services? And we have, a robust healthcare system here. We have Mercy One, Unity Point, a federally qualified healthcare center, People's Community Health Service. Again, why are we in the business of treatment? We are in the business of prevention. And so now, those are the entities that are in the schools. And so really, I have a good comfort level in not duplicating services. And so that's been really our intent. I talked about the elimination of divisional structures to promote a better understanding and collaboration of cross-program work and initiatives. As I stated earlier, when you have divisional structure, the works become very siloed. And I think that public health is very, in different areas, what happens in environmental health has also an impact on community health. And so we have to, move away from siloed approaches to things, even as a community. Improvements in recruitment strategies to increase workforce diversity and training needs. I do believe that a health department should resemble the community it's serving. And so, that's some of the things that we've been very intentional about is also increasing the diversity of the health department. We've hired community health workers, and we're just very intentional about posting our job vacancies so that we are providing equal opportunities for people of all different backgrounds to be able to apply to our positions. Improvements in public health infrastructure, identifying program needs and gaps. We're very intentional about building a quality improvement culture. So being comfortable with sometimes knowing that we have to improve some of our workflow efficiencies and having those conversations where it's a bottom up approach, right? So staff at every level feel comfortable and saying, I think there's a problem here. I'm not sure what the solution is, but I'd like for everybody to look into it. So that's quality improvement for us. And public health visibility. When I started, when I'd ask people like, so what is your understanding of public health? Again, it was very much the school nursing program. I said public health is more than just school nursing. Actually, we've shifted years ago away from just that model, especially when there are entities that can best do that. So in making sure that we are engaging with our community and we're visible and responding to the needs of the community is so important. And so I hope that you all have felt the visibility of the health department these past 18 months. So I believe this was in 2018, Waterloo, Cedar Falls was labeled as the worst place to live as an African American. I have to share a personal experience. This news, I think for some was shocking, but coming from a background that I've lived in different parts of the United States, I as a newcomer, I was like, my goodness, this community is very segregated. This community is very siloed. And so it wasn't surprising for me, this information. But one thing that I believe in is the power of being able to use very difficult news to make positive change, very, very, difficult news to make positive change. And so for us as the health department, I said, the health department, we understand that public health, that racism is a public health crisis. I said, so, team, how can we use this information? How can we use this to bring about positive change? And so we took on the role as health equity strategists. And we're very fortunate. The Kresge Foundation, which is a national foundation, funded us as the emerging leaders in public health. They gave us $125,000 to be able to implement innovative strategies to address very complex problems. And so we decided, hey, we're going to tackle this and see what it would be the role of a health equity strategist for the community looks like. Nationally, public health is being called on to be a chief health strategist. And I didn't like the term chief. Chief felt very elitist, like we knew more than everybody else. And so I said, no, this is going to need to take a collective approach. And so the health equity strategist seemed like a role that fits us better. So what is this new role about? This new role is to create a community that is resourceful and resilient to transformation and believes in the empowerment and solidarity of its residents to achieve optimal health. So how do we as a department serve as a health equity strategist? So the health department will function to serve as a resource to partners who are advocating for equity, where we play, work, learn, and worship, advancing unique and culturally sensitive strategies that promote human development and optimal health, and promote a system of shared community assets to guide the work of local partners to reduce health disparities. So how do we do this, right? So we took on a systems thinking approach. One of the things about, and I hope I'm in a vulnerable place to be able to share this, is that I believe that sometimes when conversations about race happen, it takes on an individual approach, So people, say stuff, it's like, I'm not a racist, I don't see color. I believe in equality for all. But this issue is more complex than the I. Right, it's a systems issue, right? And so we in public health, we're seeing the complexity of the system. We're seeing how it plays out and how it impacts population health outcomes. One of the things internally that we discuss is that when you look at the United States as a whole, compared to other developed nations that are economically stable as we are, we're not doing really well in terms of health outcomes. Our life expectancy is actually much lower than other developed nations. And so we have to take on a systems approach to understand what's happening within our system that is not improving the health outcomes of our population. And also removing the I from this approach, like how can we look at this with a collective lens? So we took on a systems thinking approach. That was one, to gain clarity. So to develop a deep understanding of the system and build a map that captures the key forces and patterns driving the system's behavior. And the second phase was also to find leverage, finding energy and exploring the most promising opportunities in the system that could push it towards a greater health. And then last, strategic action, designing and implementing for sustainable change. So we invited a group of stakeholders resembling the local public health system. And so these were individuals from all different leaders from all different sectors, right? So we had education, we had housing, we had government, healthcare systems. And we wanted to gain clarity in terms of like, how do they see this issue? How do they see this complex issue? So we asked them, what accounts for the level of equity within Black Hawk County, because there are things that are working in Black Hawk County. So as I stated when I first came, and I was like, my goodness, this is a segregated community. One of the positive things that I've also said, my goodness, like this is a community that is also resourceful. I have to tell you, I have never been in a community with so much resources, but I think that the biggest and most difficult aspect of our community is how people navigate all these resources that are available to them, and how can we support in that navigation. So we really didn't think that everything was doom and gloom. So that's why we frame the question is what accounts for the level of equity in our community. We wanted to know what's working and what's not working. So the things that our stakeholders identified, I have to also say local foundations also participated in this workshop. Inhibitors were racism. Collectively, the group felt that exists, that's here. Policies and politics that maintain inequity, entrenched mindsets and resistance to change. When you implement change in any organization, you have resistance. And I used to cringe when I would hear, but that's how we've always done it, And I'm like, okay, I understand, and change is difficult. I don't. I'm not naive to that, but I'm like, okay, how do we cultivate a culture where we also promote adaptive leadership, adaptive mindset, so that we can also test out these theories of change, and also make sure that people are comfortable with the process, but in also recognizing that there is uncomfortableness, like you also have to go through that in life, So financial exclusion and poverty, people felt like, there are groups of people that are actually being excluded from improving their social economic status, rejection of the other, history and legacy of exclusion, access to mental and physical health services. This one was a big one as well, because when you look at the county health rankings for out of 99 counties, we're rated pretty high for access of physical health services. But people see that as an inhibitor. So even though we have a robust healthcare system, somehow people are feeling like we have a difficult time accessing these healthcare services, And so it was really good for the healthcare systems to be there and to witness that. Fear was something that was identified as an inhibitor. And so those are things that we have to recognize, that people are fearful of things, and events that are occurring. And also lack of support to families and communities were identified as inhibitors. So the things that people felt that were working very well in our community were quality of education. That was an enabler. Diversity of the community. People felt like this diversity that we have, it's a good thing. Presence of coalitions and willingness to work together. Remember, I talked about earlier on, as the community, we have a lot of resources. And I think that's really because we have, community that is willing to engage, and there's a willingness to work together. And there's a lot of coalitions here in Black Hawk County, and a strong economy. So those were the things that people identified as inhibitors and enablers. So we asked our community, our stakeholders, that if we were to share to the world the story of Black Hawk County, like where does Black Hawk County, where's the deep structure, like where does this all begin? I'm gonna read to you what the stakeholders as have identified is happening, and this is like how people walk into our community, also feel. This is the deep structure. So the stakeholders titled it "Divided We Fall." So if you can just follow through the loops, everybody identified that this is a segregated community. So literally, it starts with when groups of people within a community are separated from each other intentionally. So then there's uninformed narratives and beliefs about the other persist. So when we have uninformed narratives and beliefs about the other, what happens is that this creates an us versus them mentality, which leads to, whether deliberately or unintentionally, the selection of sameness, right? And as a result, the inequality in distribution of opportunity and access to resources increases, undermining the ability of the community as a whole to thrive. So this us versus them increases the inequality of opportunity, of access and resources, right? And so when some members of a population are doing well while others struggle, it creates a fear. So remember when we identified fear as an inhibitor. This fear creates, what the fear does is that it creates a fear in which it drives people to either hold on to what they have and maintain as status quo, so maybe people that are in the haves, like all of a sudden, like imagine there's all these policies about, we have to examine, the inequities of our society, people that feel that they're in the groups of haves might say, well, is something going to be taken away from me? Like, what's going to be taken away from me? So maintaining that status quo, or mistrust a system which has only caused them harm. So the groups that have always been harmed, it also creates, this inequality of opportunity and access also creates a sense of harm, like, what's and fear, like what's happening to us, like we need to fight to also be able to have equal opportunity and of resources and access. And then this fear serves to further accentuate the divide between groups of people within a community, assuring that they never have the opportunity to build awareness of inherent human connection. I will share with you all this. To me, COVID-19 highlighted this. When, for example, vaccinations, right? We have, when you look at vaccinations, we have communities of color that are vaccine hesitancy. When you look at historically, the reason why is because like things have been done that have harmed them. When you look at the Tuskegee experiment, for example. So of course, people are, I've said to the team, like, we have to understand this hesitancy, instead of just saying, why are people hesitant? Like, we have to historically understand why communities of color are vaccine hesitant. See, but we also have another group that are vaccine hesitancy. We have, when you look at rural white, low income communities, they're very much vaccine hesitancy. And we also experience that when we go, as when our environmental health officers also go and just talk to them about environmental health issues, whether it's septics, water. There's just so much hesitancy, like why is government on our property? What is it that, you're trying to take away from us, So you have two groups that as a society, nationally and locally is separated, but in fact, they're experiencing this same level of fear. And so again, as a health department, I think it's our responsibility to dig deeper to understand why the divide is there and what's creating this fear that both groups are feeling, right? So, but we saw this very much with COVID-19 vaccination efforts. So I talked about, how we created, all this map. This map, it was to, and I can share with you all the link of this map. Please feel free to go in, navigate the map. You won't do anything to it, but you'll see the different stories of each loops and what it's describing. So the deep structure is what I shared with you all right now. And then there's other things also in our system. If you see highlighted in green some of the things that we're doing that are actually helping our system, like the diversification of the workforce, equity initiatives that we're seeing in our community. This is right here, you'll see it's called the report. It talks about the 24/7. But we wanted really to capture this so that people will feel included in this process, to understand that this is not about like just bad actors. This is not just about one person. This is a system-wide issue that needs to be addressed, and it's complex. It's messy. It takes time. It's not just one initiative and boom, we've solved the problem. No, this is really something that we have to be intentional about examining, and also figuring out what are some of the strategic actions as a community, as a whole, we can take to address some of these complex problems. Right here, you'll see environmental degradation. It resonates a lot to the rural communities. It resonates also to gentrification, and all the different things that are impacting our environment. Survival instincts, we're seeing that a lot. People are just trying to survive, and we're seeing, conversations about, the, what is the hourly wage pay that is reasonable for people to have a quality of life. Here we have business connections. So this map is also seen by our business community. I'm part of the Grove Cedar Valley board, and they're fully aware that we're trying to tackle this as a more as a system-wide issue. Right. So the next was finding leverage. So again, as a health department, we went through so many different things these past 18 months. The death of George Floyd. I shook the nation in the midst of a pandemic. And so we saw that here, protests happening with masks and people on. So, like I said, it's just the health department is immersed in so many different things. It's not just about, for us, health, but we look at the social determinants of health, which is, and I actually now call it the determinants of health, because I think the word social has been politicized so much. So, but we look at issues in education, issues in public safety. I have a very great relationship with the police force and public safety, because I mean, one of the things that they've highlighted is some of the things that, they're being called on is mental health crisis, and so how can we partner with public safety to address mental health related issues in the community, and so the healthcare system. So we look at a combination of things that impact health outcomes. So in the middle of the pandemic, while we were responding to COVID-19, as a team, we decided that this work cannot just stop because we're dealing with the pandemic, because violence, in the inequities in our system are still happening. They don't just happen, they don't just stop because COVID-19 is happening. So we shifted from in-person to virtual, and we invited our stakeholders to help us to better understand, what are some of the key strategies we need to implement as a community to address these complex issues. So these are our leverage hypotheses. These are some of the things that the community, the stakeholders have identified. So they said one of them is facing fear. They said it's really important to reduce segregation, profiling, and discrimination. So as a department, we're thinking about, okay, how do we help collectively our stakeholders to to come together to implement organizational strategies or community-based initiatives to help reduce that segregation, profiling, and discrimination. Passing the mic to build a sense of belonging, right? So not having this sense that, like, remember I said, as the chief health strategist, like, it comes across as very elitist, and that doesn't, create an environment of welcoming for different perspectives, so that's why we called ourselves a health equity strategist. So as a department, being able to say what other organizations or what are the community leaders out there that can better inform our decision making and our practices for the community so that we cultivate that sense of belonging, right? Um, and it takes a village to increase community resources and capacity, So it's this mindset, like it's not just on the shoulders of one organization. I think it's unfair for it to be on the shoulders of one organization because our community members do not just um, deal with one organization. They deal with all of us, right? So how as a community we come together to increase community resources and capacity. So it takes an entire community so they labeled it takes a village to be able to address the inequities within our community. So this is another map that is in this link I will send you, but this is the map that identifies, the key leverage spots, the things that we need to work on. It looks really complex, but it looks that way because the system is complex. But again, feel free to navigate this. You will not do anything to the software, but it's just we wanted to capture data that shows how complex our issues are, right? So that people don't feel like these are just like transactional, like we create an initiative and boom, we solve the problem. No, it's more complex than that. So you will see, like when you go in the software where it says passing the mic, you can click on that. You'll see some of the communication, the data that it's in there. It takes a village, facing fear, and this is fluid. We're still adding data to it, so here you'll see this loop, right? It's like, okay, if you level of awareness and personal connection, so I asked internally, our team is doing a lot of health equity trainings, a lot of equity trainings. And one thing that's come out of that is that people just want to be with people. So we, team members were saying, well, we want to know about this program. We want to get to know them, So we've had to implement strategies in place where people get to know other people, so that you build that human connection with each other, So I think that if we're communicating it out to the community, we also need to model it internally. And this is where organizations need to start connecting the mind and the heart. I think traditionally organizations tend to be very mind focused, very technical, managerial approaches, but that kind of style doesn't work anymore for us. We as a health department, we're very intentional of connecting both our brain and our hearts to better serve our community and to better serve ourselves internally. So this is just a link, and like I said, this is something. If you go to our website, you can see that, and I can also share this PowerPoint with you all. And these are just images so you all see when we talk about the importance of continuing our work. So we did it virtually. We didn't stop because it was just COVID-19. We continued because the inequities were actually COVID was highlighting the inequities of our society. And then this we had, how people go to the wine and paint. We are very fortunate. I'm very proactive in seeking funding that also helps us, to do some of the wellness initiatives that we need to do internally. And so again, we're very fortunate, like organizations like Kresge Foundation gave us that flexibility. And so this was a painting session and we called it the deep water. Basically, it's the fishes are navigating through the deep water. And if the deep water is not healthy, the fishes can easily die. And so it's also important for us to always look at our water, and that's some of our equity work, is to look at the foundation of our system and how this foundation, whether intentionally or unintentionally, continues to promote the health inequities that we as a public health organization are seeing. So then this is just also internal capacity building I want to share with you all. We partnered with the University of Iowa. One of the things that I asked them to do is to create a health equity curriculum. So we call it health equity, not because it's just health related, but I think for health is a holistic thing as well. But to create a curriculum in which any organization, whether it's foundation, whether it's business, whether it's healthcare system, to use to build that internal capacity to understand equity as a whole. So the goals was to create a working environment where everyone feels a sense of belonging. Everyone advocates for health equity, and establish the building blocks for a sustainable culture of health equity practices to transform public health in Black Hawk County. My ask was that I don't want people to see that health equity is what is it? Is an initiative or is a need because they all of a sudden have a person of color in leadership. Like it has to be something where it resonates into in the walls of this organization. And I'm very blunt in saying that this is not about me. This is not about me. This is not because I'm a woman of color and all of a sudden, we're going to do health equity. No, this is in fact a necessity to move us forward, especially if we're about prevention and population health. And so I'm actually not a part of these health equity trainings because I also wanted staff to have the space to be able to communicate everything that they feel during these workshops. So this has been our journey, where we are. We just finished our difficult conversations, where through this, since March, we've been going through this process. And one of the things that came up was that staff wanted to be equipped to be able to have difficult conversations, like how do we have conversations about health equity? How do we, what do we say when somebody says something uncomfortable, or, how do we ask questions that maybe we don't, might offend someone, but we're curious about, right? And so it was a very great workshop. I got the feedback, but these difficult conversations workshop was to discuss what topics are difficult to talk about, identify tools and approaches and pitfalls to engage in difficult conversations, provide opportunities for practice of engaging in difficult conversations, and increase confidence and ability to effectively engage in difficult conversations. And so I participated in that one because I just heard how great it was and how they appreciated it so much. So in October, our session is tomorrow. We're going to talk about factors that create vulnerabilities, the current systems and health equity. Consider how historical structural violence and oppression are related to current structural violence and oppression. So I'll share with you all something. In the midst of this, we had House File 802. And that's not to be political, but I needed, I think I have to highlight this because maybe people are thinking about this, and, I was like, okay, so this is a system also at play, because when you read House File 802, there's not really a punitive approach to this, but if we continue this workshop, because I had made it mandatory, I said, this workshop is mandatory because this is the direction in which public health is going. And I want to equip our practitioners to be able to understand all these different factors. And so I said, okay, House Bill 802 is saying that maybe we can't do this. So I called the state, we had discussions. They're still doing some level of health equity training, but our health equity training wasn't like, oh, you come to a workshop or a talk and then you leave. Like, we are intentional about this kind of work and how it translates into practice. Like, it's a journey. For me, it's not one-stop shop. So long story short, I decided to make the workshop voluntary. I said, you know what, because of this and is happening, we're going to make this voluntarily. And we still have about 100% attendance, so this workshop is still happening, So I think that is also important for people to understand, always understand the why behind, my intent has always been, this is not to create silos and divisiveness. Public health we have endured that for these past 18 months. But this is, we all, if we're really in public health, we have to understand the different communities we serve, and also the historical and present day impact that's creating the inequities in our society. So this is just feedback from one-on-one conversations. Again, like I said, this is a pilot, so we're always asking staff, how can we improve? How can we better? So they said valued most learning about coworkers, hearing different perspectives, learning about own biases and gaining knowledge, dedicated time for health equity, feels like health equity is a priority at Black Hawk County Health, more conscious about health equity, how it relates to the job, and sharing knowledge, learning with family and friends, and more open to learning more on own. I mean, some of the examples now the team is sharing, I have felt so fortunate to really hear how they're applying it professionally and personally. Some of the things that they've said that valued least, so short time frame, virtual, not going deep enough. So some of them, we have some staff that already had some level of knowledge about health equity, and some of the historical policies and practice that promote racism. And so they actually were like, we need people to go, the facilitators to go deeper. So that's something for us to understand too in the future. Too much focus on race, right? So this one was interesting to us because the health department isn't as diverse. And so I think that one of the feedbacks I think people wanted to also hear about is white poverty, the rural experience, and so those are some of the things that we want to continue to build upon in our curriculum and take time away from work. I actually know which team says this, but our environmental health officers are constantly on the go. And so it's been hard for them to balance just coming to the workshops and also having to go out and do some of the assessments and stuff, So we, again, this is a pilot we're going to continue to build upon. And I know that I've gone a little bit over my time, but we're very intentional about building it, this curriculum, not just for Black Hawk County, but for the state and also nationally for public health. External capacity. So right now we are re-engaging our systems thinking task team. Our stakeholders have said, okay, there's been too much of a pause. We need this work to continue. So on Thursday, actually, October 13th, we'll be re-engaging them to see, okay, what are some of the next steps that we need to take. We're very intentional about deepening and broadening partnerships across the community for increased engagement and shared power and equity-informed data. The health department is going to be a data hub for the community. We've asked the state to give us a lot of data, that relates to Blackhawk County. So we're going to build that data hub so that if Waterloo Community Foundation is saying, hey, we need data on X, Y, and Z, our health department should be better equipped to give that data that you need. We're partnering with the food bank as well. And so very, very exciting, stuff coming, but COVID has slowed us down a little bit. Harness existing community resources. We want to be that resource where, we know everything that's going on and we can inform people like these are the different resources and how do we support the navigation of those resources as well. And developing a toolkit, as I said, for health equity training curriculum. So that is all I have. I'm going to stop share screen, and I know we have time for Q&A as well. So thank you once again.
Got involved in the listening and forgot to unmute. I want to thank you, Dr. Egbuonye, for giving us a presentation and an overview. What I heard you say is that from a team approach, you wanted to collaborate to create a change to meet the needs through communication as a community of public health for Blackhawk County. And I think it's imperative that we understand as members on the Waterloo Community Foundation, Windows on Waterloo, that it takes more than one organization to create that change. It's going to have to be collaborative. We're going to have to work together. And my first question is, and I know you talked about training and such, what is the next step? How can we as a community get engaged with public health and be helpful?
Thank you so much for that question. Again, I first, I want to thank you all for supporting us. And I hope that you have felt the service mindset of our team. This is really, the individuals in this department are not doing it for the money. This is coming from their heart. They are intentionally always trying to serve the community. I had a daycare director yesterday just said, when we call public health answers, So I hope that you all have felt that way. I think the biggest thing is for me, I would say is advocacy. We have been good stewards of our taxpayers' dollars. And we are very intentional about every program area that we do. We're very intentional about proactively seeking outside revenues, And so when you hear things happening at the county level in regards to public health, I urge you all to call us and ask us, like, what's going on? How do you need our support? Or what, even clarity, even if you say, oh, I'm not really sure about this regarding public health, we are open to answering your questions. I think that's why the biggest thing when I say this is a collective effort, for us, population health is a collective effort. And so I want the community to know that we have always been intentional about doing the right thing for the community, even though at times things get politicized. We think about you all, we think about the economic, that's why, not to be long-winded, but when the Tyson outbreak happened, we could have easily been like, Tyson is bad, all this stuff, but you didn't hear that from public health. What we did was we shared with the community the data, But behind the scenes, what we said to Tyson, we have to partner. So we implement strategies in that plant, safety strategies, so that we both walk away feeling good about this. And it was a partnership, you know. And so today, like, we regularly meet with Tyson. Every Friday we meet with them. They're informing us at the corporate level, at the local level. And so I think it's unfair that public health tends to be siloed as though we don't care about the economic impact. That is absolutely not true. We care about the economic recovery of this community. And so we're very intentional about that. So thank you. Just public health advocacy is what I'm asking. And if you don't know how to do it, feel free to reach out to us.
My next question is, and it's probably on the minds of some of our audience, what is the difference between public health and private health? Because we get them confused, because when our last conversation, I was talking about a certain project and you said, no, that's private. So please explain so we understand the difference.
Public health does not want you to get sick. That is just that, it's that simple. We do not want you to get sick. We understand that, you know, there are certain times we can't control that for genetics, right? But outside of genetics, we want to make sure that environmentally, we want to make sure that mentally, physically, and mentally, you have everything you need to live that quality of life. So public health is like, you know, let's reduce those emergency room visits. You know, let's, if you are pre-diabetic, let's not get you to the diabetes status. Like, what can we do? And so that is what we do, is that the prevention. And we do have a very good relationship with the healthcare system, because they're also, right now, the way the healthcare system is set up, if they keep seeing the same people in the system coming back, their reimbursement rate are much lower. So they're like, public health, help us keep people out, right? And so this is where our relationship, our partnership happens. We are partnering with Unity Point to launch a doula project, right? For, we're seeing the African American maternal rates, there's disparities, right? And so the state has launched a doula project in which they're partnering with, you know, with Blackhawk County. And so we're partnering with Allen Women's Health to do that. So those are some of those preventative population health-based strategies that we're implementing, so that people stay out of the hospitals.
Excellent. Now I will open up to any of the audience for questions for Dr. Egbuonye. Wow, I guess you answered all the questions. So let me further dig in deeper. When you talk about collaborating with partners, what are you looking for in partnership? I know you talked about advocacy, but what are you, when you're looking at partnership, what are you looking for?
So I think that also, you know, what I'm looking for, I think for us, when we, you know, it's actually in our strategic plan, that deepen understanding of you know, and relationship building, right? So I'll share with you, like, some of the changes that the health department has done, you know, has had a also negative impact with some of our partners. Like, you know, these are changes that, you know, might have that maybe people weren't prepared for, or we still needed time to have a better understanding of the direction in which organizationally we were also going. So I think that it's so important for us to always give each other grace, you know, in that we might have had, you know, hiccups at the beginning, but it doesn't mean that we should stay like upset with each other. So I think that's a human like element of ourselves as leaders. We have to also take a moment and pause. You know, we put the reset button. So I think that you know, asking what do we need from for our partners, I think it's a mutual thing, right? So we have to be able to give people, leaders, the grace and to make mistakes, and vice versa, so that we still come back at the table, But if we as a society hold grudges, if we stay mad at each other, there's no moving the needle, and so I see that very often, even in some of the conversations that are happening right now in the community. You have groups really angry, and it's like, okay, it's almost like, is there a mental health facilitator to de-escalate this so that people can also come back and say, okay, let's hit the reset button, And so I think that, my ask is that, if we ask, you know, um, to join us, it's give us that grace, that we're humans, just in leadership position, we make mistakes, but we're always, I think the common goal is always to do greater good for the community.
Excellent, excellent. And as we wind down, I'm gonna give the audience an opportunity if anybody have a question. Hearing none, I know that's fast, but I'm gonna move forward. It appears to me that our public health for Black Hawk County is meeting a great need. And it sounds like under your leadership, you're pushing listen to understand, and communication is key in order to move our community further ahead in relationship to be that public health to keep us from going to the hospital and meeting those needs. And so I want to once again thank Dr. Nafissa Cisse Egbuonye for coming on and giving us an update. And I know some of you wanted to know, or probably wanted to hear more about the pandemic and how the vaccines are working. And I think that's still being reviewed by researchers. So I didn't want to go into that, but I do want you to know, if you have questions, please do not hesitate to contact the public health department and get your questions answered. There's not anything worse than having a question and not going to the source to get the answer, because it's imperative to do that. And once again, thank you, Dr. Egbuonye, for presenting today. I want to also inform our community that on November 4th, Teresa Hoffman is an attorney, and she's also a board member, and she's going to talk about charitable giving. And that can work for many different ways. That can assist you in your organization. It can assist individuals that you know who are reaching that life stage that they want to leave a legacy to the community. And then on December 2nd, we have Jared from Allen College. And I know Jared very well also. And I think these next two presenters will give you food for thought. So on that note, once again, Dr. Egbuonye, thank you, thank you, thank you. And on that note, everybody have a great day and enjoy.